Hello, everybody, and welcome back. Welcome back to my channel, Health and Medicare Insurance Simplified. Our goal is to provide you answers you need to all your health insurance options and all your Medicare options. Now, today, so you don't think today is the romance edition, yes, I am filming this from my bed. It's because I'm very sick. I feel like I got hit by the proverbial ton of bricks, by a freight train, whatever painful analogy you want to use. That's what I feel like right now. I feel like a mess of you know what. Why? Because I just yesterday got my shingles vaccination, and I thought, oh, what a great opportunity to talk about preventative services that you have inside your health insurance program. No matter what age you are, we're going to get into that here in just a moment. But why is it because of the shingles vaccination for me that I'm feeling sick and in bed? If you know anything about the shingles vaccination, it's got a terrible side effect of just laying you out. I feel like I have heavy flu symptoms without actually having the flu. Now, I got the shingles vaccination, and again, it comes in twos. You get one right away, obviously. It starts the process. About 4 to 6 months later, you go back in for shot number two. So, yesterday, about midday, I got shot number one, and they warned me with a slight smirk on his face. My primary care doctor warned me what was going to happen, that it was going to lay me out. And sure enough, by 4 p.m., about 4 hours after the first shot, I had to come home and get in bed. And it's pretty much been where I've been ever since yesterday's vaccination. So, did you know the Affordable Care Act, when it was signed into law, it was signed into law in March of 2010. One of the things that the Affordable Care Act mandated was free preventative care, at least those preventative measures that meet their definition of preventative care. Prior to March of 2010, many of the preventative services we know of today, mammogram, annual physical, wellness colonoscopy, blood pressure screening, vaccinations, those were not necessarily always free to you pre Affordable Care Act. But today, please know you've got many of those services available to you free of charge. And while I just mentioned specifically the Affordable Care Act and therefore Obamacare, please remember the Affordable Care Act mandated certain things, yes, in what became known as Obamacare, even in Medicare. Okay, so preventative services, no matter what age you are. I just mentioned many of them. I mentioned annual physical. By the way, you're going to come to see that the preferred language now is annual wellness check. Okay. So you get the free annual wellness check. You get the free wellness or preventative colonoscopy. Now, it's important to remember here on things like, say, you go in for what you thought is a wellness colonoscopy, but unfortunately, something not good was found. When it comes time for the billing to go out from that provider to your insurance company, there's a medical billing code that gets placed on the bill by your provider that then gets sent out. That medical billing code is going to show it was diagnostic because it found a problem. Now, preventative measures mandated as free to you because of the Affordable Care Act do not cover as free services when something is billed diagnostic. They have to be able to go in, perform that colonoscopy, give you a clean bill of health as a result, and put a medical code that signifies preventative. This person's good to go. Nothing was found. That one is free. Another example that's important to keep in mind, let's say you go in for your annual physical. But let's say the blood work comes back with something negative. Well, your doctor at that point is going to want to do the appropriate thing for your health. They're going to send you back for more blood work. In that case, the first set of blood work is free. It was merely to check for preventative purposes. Were there any issues going on? It now came back signifying, yes, wait a minute, we have an issue. You were sent back out for blood work number 2. Unfortunately, blood work number 2 is not going to be a free preventative service. You will be subject to what we call cost sharing. In other words, subject to your deductible, subject to maybe a copay or co-insurance. Okay? Now, there are many, many free preventative services available to you. So, whether you're in the Affordable Care Act for your health insurance, whether you're on a group employer plan, whether you're on Medicare, please reach out, whether to your insurance company or your local agent, like myself. That's one of the things I'll help you with. I'll help you understand what services you do have on an annual basis that are completely free to you. In terms of vaccinations, the shingles vaccine is now free. Obviously, the flu shot and COVID and pneumonia, which I believe should be taken or received at age 60, all those are examples of free wellness vaccinations. There could be many more vaccinations you want to get. Just find out if it's free or not. Many of them are. Of course, we've already said things like mammograms, annual wellness checks, blood screenings, cancer screenings, very important one. Make sure you get screened for various cancers. Okay? So, I hope this has been helpful at the expense of my own personal pain to help you learn about preventative services and what you have available to you. And staying healthy, a part of that is taking part in those free annual wellness checks you have available to you. Okay? So, thank you so much for stopping by today. As always, stay active, be well, and I'll see you next time. My name's Ron Plusinski, Health and Medicare Simplified. Have a good day.